Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health, ACA Sports Council Chiropractor of the Year 2015. Happy Monday. Had a great weekend. I was actually in Wisconsin teaching a part one of a 48-hour nutrition certification course, and a topic came up that I really wanted to share with you. The top 10 mitochondrial disruptors. So mitochondria, as we all know, is the powerhouse of a cell. And it's the key element to the overall concept of us having some energy. We do so many things to damage our mitochondria. So I made a list, and I wanted to share the top 10 things that I thought really impeded on everybody's overall mitochondrial function. So I wrote them down here. It's an omega-6 seed oils, or if you will, the vegetable oils. You're going to find some interesting things there. Antibiotics, whether you take them yourselves or you consume them through your foods. Artificial sweeteners, proton pump inhibitors, NSAIDs, COVID-19 and viral pathogens, chemical endocrine disruptors, glyphosate, a little surprise, what's in toothpaste, triclosan, and last but not least, toxins in your gut called LPS and cytolethal distending toxin. Good morning. Good morning, Sherry. How are you? We're going to get to work real soon on this. So feel free. Sherry already said hello. Give me a shout out. Feel free to ask any questions. I'm going to address all the different questions every so often. Somebody will let me know when the questions are popping up. So let's dig right in. Mitochondria. Do you know that the mitochondria comes from bacteria? So the mitochondria actually communicates with its sister, its family member, the microbiome. It does so because the bacteria has metabolites that actually communicate with the mitochondria. So obviously anything that damages the gut, it should be, I could say leaky gut leads to mitochondrial dysfunction, would be a major starting point. So I had said earlier, we wanted to start off with avoiding omega-6 seed oils. Remember, if you consume them, corn, safflower, soybean oils, and the like, if you consume them, you better burn them really quick, because if you have to store them, they're going to be stored in your cell membrane. They're going to be stored like in your brain. The half-life of an omega-6 is 680 days. It's almost 2 years. So when you go into many of the restaurants, these vegetable oils are used very prolifically, if you will. These restaurants have a high proclivity for using these omega-6, these vegetable oils, and they are without question very damaging to one's overall health. So the number one vegetable oil, the number one oil that I see used or consumed in America today is soybean oil. I think about 85% of the oils that we take in are soybean oil. If you could look at many different graphs, olive oil, which is omega-9, especially extra virgin olive oil, is just a small part of what we consume in an overall diet. So let's be real careful. Let's use some coconut oils. Let's use some avocado. Let's use some macadamia nuts. Let's use some different oils to enable us to have health while we cook, because it's not just the nutritional information on the food, it's the nutritional information on what we add in. So the second thing was antibiotics. So the antibiotics that we take, whether orally, affect our gut microbiome. The microbiota in healthy subjects are typically analyzed after taking a broad spectrum antibiotic. And what they usually see, a lot of data backs this up, is an immediate reduction in species diversity. The key takeaway is that the literature says anywhere between a year and 2 years, your microbiome is blown away, blown up from an antibiotic. So when you're standing there or sitting there and the doctor talks to you and he says, I just want to give you the Z-Pack just in case, you really should think long and hard. It's going to take me a year minimum and possibly 2 years to get back my overall gut health. And as we all know, the gut is the epicenter of your health. So alterations in the gut microbiome due to antibiotic use usually leads to an increase in obesity, type 2 diabetes, and a lot of immune-related disorders like inflammatory disorders and autoimmunity. So once again, you really want to think, do I want to take that antibiotic? Do I need it? Or is it more of a prophylactic type of prescription and medication at this point? What about other antibiotics? Well, the bulk of the antibiotics that we get in our everyday American lifestyle are coming from our livestock. 80% of the 35 billion pounds of antibiotics produced each year, 29 million of those, it's million, not billion, 29 million of those come in our livestock, which would equate in our livestock to 270 billion prescriptions per year in humans. The CDC has said that 30% of antibiotic prescriptions are unnecessary, and over 50% of all hospital patients receive antibiotics. So I just had a patient today, and he said he has got to go in the hospital. He has to have this surgery. And I said to him, what are you doing to prepare for going into the hospital, which, we all know is a great place, but has a lot of germs and things like that. And you're going to get antibiotics and et cetera. There's possible COVID, et cetera. What are you doing? Are you just waiting? Because I would want to be in the best shape I could to ward everything off. Antibiotics have shown to deplete your immune system because they damage and blow up your microbes, like I said before. They also enable you to decrease or get rid of calcium, magnesium, and a multitude of B vitamins, and maybe the new jam, if you will, vitamin K. The next one is artificial sweeteners. Now, there was a discussion of artificial sweeteners. The bulk of the artificial sweeteners are given in studies to mice. However, the artificial sweeteners have shown to cause glucose intolerance in mice, typically by altering the gut microbiota, and are associated with dysbiosis and glucose intolerance also in humans. So we have it both in animals and in humans. Taking an artificial sweetener will increase your incidence of stroke and dementia by 2 to 3 times. A study showed that artificial sweeteners adversely affected the microbiome because it affected the metabolism through alterations in the gut microbiota. So essentially, aspartame, sucralose, and saccharin, that consumption led to weight gain, impaired glucose tolerance, and increased incidence of type 2 diabetes. Newsflash. The next one, the fourth one on the list, was PPI. The American Medical Association in 2016 said the avoidance of PPI medication may prevent the development of dementia. So taking these proton pump inhibitors, these trying to decrease acid when most Americans already are too low in acid, are very damaging to your overall health. So proton pump inhibitors, not protein, but proton pump inhibitors affect the gut microbiome. There's differences in the data between proton pump inhibitors and non-users. Consistently, it was associated with changes towards a less healthy gut microbiome, those who use PPIs. PPIs are one of the most overused drugs and led you down a path of an increased risk of enteric infection. Interesting. Good study that came out in Gut in 2016. PPI users had the results as following. It identified in this particular study significantly lower abundance in gut commensals and lower microbial diversity. Associated increase in the abundance of an oral and an upper GI commensals. There was an increase in streptococci, and the results were replicated in 70 different twins who were discordant for PPI use. NSAIDs, non-steroid anti-inflammatories, Aleve, Advil, ibuprofen. One of the things that I see many of my patients consume, and I try to get them off immediately, NSAIDs cause leaky gut. NSAIDs cause inflammation. Non-steroid anti-inflammatories decrease pain, but they impair healing. Nutraceuticals decrease pain but promote healing. Which do you want? Interestingly enough, the NSAIDs damage your gut. They damage your tight junctions. They allow for an excess release of histamine. These NSAIDs are not going to allow you to heal. They're tremendously disruptive to the gut. 80% of your immune cells are in your gut. NSAIDs are not a good choice. So we're halfway through stuff. Do we have any questions? Because I can't see them. The sixth thing was the virus and COVID. So SARS hijacks the mitochondria. I've called it the vampire of the mitochondria. It manipulates directly mitochondrial function to evade host cell immunity. Unfortunately, because of these mitochondrial function, what you're seeing is more chronic metabolic disorders, more fatigue, and many people are more susceptible to infections. Also from the virus, from COVID, specifically damaging the gut. So the gut microbiota composition reflects very differently post-COVID. You have dysbiosis, unleveling of good and bad bacteria. You also have damage to the gut lining. So this COVID also damages the gut, and the gut does, as we said earlier, communicates with the mitochondria. Seventh thing, interestingly enough, were endocrine hormone disruptors. Endocrine hormone disruptors like BPA, BPS, BP, anything. They come from receipt paper, they come from sports bottles, children's toys, canned food, and the like. This BPA, BPS is an endocrine disruptor. Essentially, what it does is they're the receptors, and it mimics different hormone receptors and blocks them. So hormones like estrogen constantly go through and are not able to go in the receptor sites and get to the liver to be detoxed. So essentially, these chemicals that are used in BPA-free products exhibit similar endocrine disrupting effects as BPA, and all of this can trigger fat cell formation and a decrease in efficiency of the mitochondria. Glyphosate. The World Health Organization has called glyphosate a cancer-causing chemical. It's in Roundup. 93% of our soils are full of Roundup. Only 7% are organic and shrinking. Glyphosate acts as maybe the world's most powerful antibiotic. It blows everything up. It's a nuclear bomb to your gut. It's thought as beneficial bacteria in your gut. It actually mimics hormones like estrogen. It impairs the function of vitamin D, and it depletes the gut of key vitamins like iron, cobalt, molybdenum, and copper. So without question, you want to avoid the consumption of glyphosate as much as you can. I talked about it before. A common toothpaste ingredient causes gut inflammation. It's actually in over 2,000 products. Millions of pounds of used of this per year, and 75% of individuals that were tested for it were tested positive. Triclosan. Triclosan is in toothpaste. It's in cutting boards. It's in school supplies, textiles, cleaning supplies, cosmetics. It causes inflammation in the gut. It alters the gut microbiota, which obviously damages the effect and the efficiency of mitochondria. It enables people, unfortunately, to put them on a path towards IBS, and it stimulates the receptor toll-like receptor 4, not to get too technical. That toll-like receptor 4 stimulates NF-kappa B, which also stimulates the NLRP3 inflammasome, which has a release of all these interleukins, very deleterious, very inflammatory. Some of the gut bacteria toxins. The big one I want to talk about is LPS, lipopolysaccharide. It's an endotoxin on gram-negative bacteria. When the bacteria dies, the LPS passes through the intestinal epithelial cell and enters the bloodstream. Chronic dysbiosis can then lead to the breakdown of epithelial cells due to constant translocation of LPS. Systemic LPS is linked to multiple disorders. So, leaky gut is first. Number 2 is dysbiosis on leveling of good and bad bacteria. And number 3 is the release of LPS. LPS is extremely draining on the mitochondria, and it also damages many different organ systems, like the brain, like the joint, like the thyroid, like the lung, like the liver, etc. LPS, interestingly enough, damages the mitochondria because of stimulating that inflammatory pathway, NLRP3 inflammasome. So it has a direct stimulant, and it just, without question, drains the battery of the mitochondria. Lastly, then I'm going to open it up for some questions. LPS is shown to increase muscle pain. So chiropractors, manual practitioners, patients, everybody, don't just look at it as a muscle. Understand the muscle is imbued with energy from mitochondria. LPS causes inflammation and mitochondria impairment. So we got some questions, right?
Oh, yes. So Sherry says, what is the better toothpaste to use?
Great question. So I got a whole bunch of stuff here. Here we go. So, yeah, I didn't see it. What's the better toothpaste to use? Hey, Sherry, how are you? Great question. Organic toothpaste that does not have triclosan and these other chemicals in it. So essentially, if you're looking at our body and understanding that we need to detox all the time, we're full of chemicals and toxins and everything, and we need to detox, we need to start using and being more aware of the environment. To answer your question, find a good organic toothpaste. What can we take in place of NSAIDs? So I'm going to put that one up. What can we take in place of NSAIDs? That's a great question. Non-steroidal anti-inflammatories. Here are some of the things that I would recommend. Always start with diet, because food is information, but bad food, can stimulate inflammation and therefore stimulating pain. So obviously good foods, whole foods, your good organic, your fruits and vegetables, your grass-fed beef, your smashed fish, your if you're going to do some starchy vegetables, great. But some of the supplements I would recommend for pain instead of NSAIDs would be turmeric, ginger, turmeric, curcumin, ginger, omega-3 fatty acids, and without question, pro-resolving mediators. So schizophrenia, well, that is not my area of expertise, but what I would recommend for schizophrenia, there's a lot of issues with anxiety and anxiolytic type of possibilities from the gut to the brain. So I definitely recommend from a natural perspective to start treating the gut. So I think we've got a few other shout outs. We got Jeff, who's a shout out. We've got a few other shout outs. So I appreciate all the shout outs. I appreciate you sharing this. Please feel free to like it. I'm here several times a week on Friday. Just make note, I'm going to have a special guest, Dr. Dane Donahue. We're going to go live, and we're also going to turn that into our podcast. Please, everybody follow me on my podcast, Proven Health Alternatives, and my YouTube channel. I'm always happy to be here. Dr. Rob Silverman, always yours in health.